What is my approach with pediatric airway and enlarged tonsils? So that one is kind of a big one. Anytime I see a kiddo with, oh, hi, Judah. Anytime I see a kiddo with airway issues, if we're not breathing well, don't seem to be sleeping well, there are issues with airway, then we really want to get to what the cause of it is, because there are multiple potential causes. If we feel like it truly is airway, either their anatomy is too small or there are enlarged tonsils making it too small. If tonsils are not a factor and it's just anatomy, then obviously we want to look at that, but there are dental solutions to that, like expanders, myofunctional therapy, lip and tongue tie revision, things like that. If we know that the tonsils are enlarged, which a lot of times we can see visually, even though I'm not an ENT, I can't diagnose anything with the tonsils, but if I see that they're kind of big and bulky, or if it looks like the tonsils are kissing back there in the back of their throat, then again, the ear, nose, and throat doctor is not my first go-to. We really want to see, if we can, why those tonsils are enlarged to begin with. If it looks like there's some, we want to check for food intolerances, allergies, then we might be referring to our functional medicine practitioners. And we've got several pediatric functional medicine docs who are amazing in the area. It could be that there is a lip and tongue tie that's causing some mouth breathing, and the mouth breathing is then causing inflammation in the tonsils. That can cause the tonsils to be enlarged. So then our answer might be, or one of our answers might be, to revise the lip and tongue. It just kind of depends. So every kiddo is different, and it's just a matter of getting to those root cause issues. But if there's any way that we can address that tonsil or adenoid hypertrophy, those really, really large tonsils, if we can refer to a colleague who can address the root cause and get them to shrink up on their own, that's always ideal. It can't always happen. And so then we have to balance that with how bad are kiddos' symptoms. If we're really having a rough time and we're really not sleeping and it's impacting behavior, it's impacting growth, it's impacting health in other ways, then maybe our first referral is the ear, nose, and throat doctor. So it just kind of depends, and depends on the severity of the case. Okay, next question were thoughts on getting dental work done during pregnancy, specifically in the first trimester. So excellent question. It is typically very safe to get dental work done during first trimester, during any part of pregnancy. Most of what we do is safe, and you just always have to weigh the risk and the benefits. If we have a choice, if it's something that's not urgent and we can wait until second trimester, then we want to wait until second trimester. If it's something elective, then yeah, we prefer, let's just put off the elective things if we can until after baby's here. But if it's something where it's more disease management, like there's a cavity that needs to be treated, then, or especially if there's any kind of gum inflammation, gum issues, then a lot of times treating that sooner rather than later is best. But if we have a choice and if we can wait, then the second trimester is kind of that magic time where everything's just a little bit easier. As far as what we do, we're always careful with x-rays, but even more so when people are pregnant, when women are pregnant, sorry. We want to make sure that we're always very, very careful with who we give x-rays to and how much. So we make that as minimal as we can. We typically are not going to do any kind of laughing gas. So our sedation options are obviously much, much different when someone's pregnant. And we want to make sure that we're working hand in hand and we are at least collaborating and getting the okay from midwife, nurse practitioner, OB, whoever is taking care of you while you're pregnant. So that is that. But typically we can do most anything treatment-wise